Thanks, everyone. It's really a blessing to be here with you today. Thank you so much for taking the time to spend with us for a little part of your afternoon. Thank you so much, Lynn, for having me. I really appreciate it. I love coming out and talking about Dunham House and talking about mental health and addiction. I am a person in long-term recovery, which means I haven't had the need to take any substance for the last 16 years. For this, I'm eternally grateful. I'm also blessed because through my own sobriety, I have discovered what I want to do with the rest of my life. You know, a little late, but I discovered what I want to do with the rest of my life, and that is to bring people into recovery, to help them make meaningful changes and to change the family story for themselves and for their loved ones. So Dunham House is really a labor of love. It was started years ago, about 13 years ago now, by Dan Colson. A group of people started it. It's just really a lovely place of hope and healing. The reason why I introduced myself as a person in long-term recovery is to show you that we can recover, and that I get to go to work every day at Dunham House, and I get to see miracles. And that is, I mean, not a lot of people can say that they go to work and they see miracles, and I'm blessed to do that. So we're going to do a little presentation about what our center is like in the Eastern Townships. We are in the city of Dunham. We have a beautiful property. And then I will go on to explain a little bit more about our outpatient services. We do have an outpatient office at the Queen Elizabeth Health Complex. So that's where we triage people that are maybe pre-contemplative to going into treatment or having any sort of treatment or counseling. That's where we do our aftercare groups, etc. So if we could start, that would be lovely. Okay. And then I just do this, right?
I'll show you. Yeah. There we go. So just do left and right. So if this is the one you want to go to, your next one.
Okay.
Okay.
Perfect. Perfect. Thanks so much, Jason. Thank you. I'm very technologically challenged, very passionate about what I do. Tech and me, not such good friends. Okay, so we're going to give you sort of an overview of Dunham House, the clinical program and services, the recovery journey, the inclusions and exclusions, and referrals and collaborations. And then we can have a discussion. If you guys have any questions or anything of that nature, it would be really, we would love to hear from you. So we were founded in 2017. We have a 38-bed residential treatment center, which is in the townships. It is co-occurring mental health disorders. So what that means is we deal with both at the same time, which is best practice and evidence-based. We provide individualized and evidence-based care to clients across Quebec and the northeastern United States. And we, like I just mentioned, we do have an outpatient at our Queen Elizabeth Center. So just to give you an overview, we are a charity. We are guided by a board of directors as well as an advisory board. So leading our mission with the dedication and compassion, Dunham House is overseen by a group of professionals who provide strategic direction and unwavering support guidance, ensures clinical excellence and community credibility. So as you can see, our board of directors is Daniel Colson, Ronald Lukes. I won't go through all of the names, but just some notables would be on the advisory board. We're very fortunate to have the Honorable Jean Charest as our chairman. We have Dr. Juan Negretti, who is a renowned psychiatrist, as well as Warren Steiner. We also work with another psychiatrist that we'll get to later, not on the advisory board. So our advisory board is very active. They know what we do. They're on board. They support us in many different ways. And for that, we're super fortunate being a charity, you know. The leadership, so we have Victoria Della Porta is our executive director. We have Murray Broman, who's our general manager, Shannon Partridge, who is our clinical supervisor, and myself, I'm the director of admissions and outreach. So our clinical team is comprised of different clinicians with different, let's say, ways of doing things, right? Different disciplines. So we have educational backgrounds include psychology, social work, behavioral health disciplines, expertise, of course, in addiction and mental health, concurrent disorders, and trauma-informed care. We do have some medical surveillance on our site. We are not a medical facility. However, we do have a psychiatric nurse that is with us a couple of days a week, so she is able to triage different areas for our clients. And we also have a medical doctor, Dr. Daisy, who comes in once a week, again, to triage medical issues with our clients. There's clinical supervision, ensuring that evidence-based treatment is delivered, ongoing guidance and support for the clinical team. The clinical consultation and diagnostic support is through our advisory council of psychiatrists. Collaborative care, very interdisciplinary team, meetings focused on individualized care, partnerships with healthcare and communities reintegration organization. So that's really like what I'm doing here is sort of coming here, letting you know about Dunham House, letting you know that we exist, letting you know some of the things that we, you know, take care of and can look after. The truth of the matter is that everybody knows somebody in recovery. Somebody is recovering from something, whether it's substance, behavior, trauma. People are recovering from something, and so everybody knows somebody. And we just want to, you know, spread the net as wide as we can so that we can help support people that are facing challenges or difficulties, right? Clinical approach, we have, like I said, it's a unified approach to addiction and mental health, dual diagnosis approach, very trauma-informed, evidence-based modalities, CBT, DBT, motivational interviewing, and relapse prevention. We have an interdisciplinary teamwork, which I outlined previously. We also have aftercare, peer support, and alumni. So it's all very well and good for somebody to come into an inpatient residential facility and work on themselves for 30 days. But what happens after, right? What happens after when they leave? We don't just put them at the door and say, good luck. You know, it sort of doesn't work like that. The aftercare is almost more important, but certainly as important as the inpatient. To continue to use your skills, to continue to do outpatient and aftercare. So all of that is very important in terms of peer support. We have coaches that have come to us through Griffith Edwards, which was associated with the Montreal General. It has since been closed, but we were very fortunate to inherit their peer support recovery program, which is also wonderful. It is a free program. These individuals are in recovery themselves, and they are paired up with our clients, our residents who have similar stories to theirs, if you will. So we do have a number of different programs. The residential programs consist of the 30 Days Foundation of Change. It's introduction to basic recovery concept and skills and development. It's very much a stabilization period. We also have 3-month integrated developmental programs. That's more focused on emotional regulation, trauma, communication. We do need clients with us for a certain period of time so that we can sort of perform the surgery, if you will, and then be able to close them up so that they're okay to go. So when we're dealing with the 3 months, it's a more intensive dive, if you will. We have this 6-month transformational program, deeper therapeutic process with sustained recovery and reintegration support. Our outpatients services consist of a 12-week program. There's individual and family programs. I'll get into that. I have a small presentation about our outpatient facility that we have at the Queen Elizabeth. So these are some of the program themes: foundations of recovery, exploration of self and identity, understanding relationships, core beliefs, parts and narratives, reframing and resilience. Alternative therapies are offered that complement traditional treatment methods. So we have a lot of lovely life skill programs, healthy living type programs. We have a beautiful greenhouse that our residents, can partake in doing the planting and, doing all of that. We're actually an award-winning greenhouse because our chef has put a few of our fruits and vegetables forward, and we won. And so we're very proud to tout our horn about that. We have pottery, we have yoga. All of this is designed in order for the individual to start getting contact with themselves again, right? Or maybe even for the first time, right? The mental health framework. So how it normally works is there's an initial assessment with an advisor. Normally it's with me. I do answer the phone lines. So often it is with me. I will sort of qualify them, if you will. Do you have an addiction problem? Do you have a mental health problem? So when they come in after all of that and they are in our facility, there's an initial assessment with one of our counselors. There's an assessment with the psychiatric nurse. The nurse will determine whether or not there needs to be further assessment through a psychological assessment or potentially a meeting with our psychiatrist. There are assessments through GPs. We have referrals from GPs to our partner psychiatrist. So really what it is, it's an integrated care plan. So we deal with it as, not a piece here, a piece there. Under our umbrella, we deal with everything. Detox aside. You need to be detoxed when you come to us. You need to be stable when you come to us, right? So we deal with that. Then we work on reinsertion, looking at you going home. Then we support you as you re-enter back home. Do you need a job? Do you need a housing? We sort of look at all of that to make sure that you're very well resourced before you leave our facility. So dual diagnosis, why is it important? We touched on that. Dual diagnosis refers to the co-occurrence of substance use and mental health disorders. 50 to 70% of individuals with substance use do have co-occurring mental health problems. Untreated psychiatric symptoms are at a higher risk of relapse. Through a range of evidence-based addiction therapies, we address complex conditions and help reduce the long-term risk of relapse. And the integrated care improves retention and outcomes. Like I said, if it's a full spectrum care, if the individual is being followed, being motivated, has a touch point, is accountable, so to speak, the outcomes are much better, for sure. So the monitoring and reintegration, we do have a number of associate models, which would entail some counselors that work for us, some psychologists that work for us. We have the peer mentoring, as mentioned, the alumni program, and we are sort of expanding our reach by strengthening outpatient and follow-up care capacity. So we're looking at reintroducing more services in our outpatient office, such as potentially case management, recovery coaching, family recovery coaching, things of that nature. So, it's ever growing, really, what we're trying to accomplish here, and we're really making great strides in providing that full spectrum of care. So just so that you know what the recovery journey looks like, there's an inquiry. It's normally to myself. Again, I qualify them. And then we move on to an interview. We interview each client on Teams. We ask them their background. We want to make sure that we're the right place for them, right? That we can help them, that we can be of assistance to them, that they fit our criteria. After the meet and greet, it's done with myself often and our clinical supervisor, often with our executive director as well. It's always good to have different eyes on an individual. That's also one of our strengths, is that we just are not looking through one lens, we're looking through numerous lenses. Then there's a decision made. Is the person, coming in? Then we do an intake, we send them off a welcome package. And then when they arrive, they have individual and group therapeutic activities, some of which I outlined, the yoga, the pottery, our beautiful award-winning greenhouse. We offer the peer support. We have outpatient, our alumni, which is a lifetime alumni group. Everybody that does finish our program is invited to our alumni group. That runs once a week for an hour. It's a really good place for them still to maintain the connection to Dunham House. We're not a very facility that is, medical looking. It's a house, it's a home, it's a place of hope and healing. And so that's really what we try and, cultivate with our residents and encourage them to participate in our alumni. And then sustained recovery. So that's really what it looks like. Inclusions and exclusions. You have to be 18 years old, primary diagnosis of substance use disorder, meaning you have to identify in having a substance use disorder. It can't just be mental health primary. We don't deal with just mental health primary. We deal with both together. The willingness and ability to participate in a structured residential program, able to take care of themselves and manage daily activities, physically and mentally stable to engage in group and individual therapy, and they have to demonstrate a commitment to recovery and a willingness to follow the house rules. So, we are running a community, and 38 people, it's a community, right? There's a lot of different personalities, people are at different areas in their recovery, and so they really have to be willing to be there and be open to working on themselves and working on relationships with others. So exclusions would be need for medically supervised detoxification. We do not look after that. Pardon me. Serious psychiatric disorders that aren't managed, active psychosis, suicidal ideation, homicidal ideation, things of that nature we will not look at. A history of violence or aggressive behavior, severe cognitive impairment precluding participation in therapy, legal constraints, convictions for violent crimes or sexual offenses, court-ordered restrictions. We don't deal with any of that. We run a very clean community. We want to make sure that everybody is protected. And so we have these inclusions and exclusions to protect the community and to protect, our staff at large. So the referrals and collaboration, that would be myself. There's the website. Also clinical is Shannon Partridge. Her information is here. Any of this information that you would like, I'm sure that it would be very readily provided by Lynn. And so that's where we come to the conclusion of the first part of our presentation. Thank you for your patience. I know it was a bit long. I'm going to invite my friend Mary up now. She's just going to talk about our community outreach and what that is looking like for us. And then I'll come back and I'll give you a little bit of a rundown, more in depth about our outpatients, how we look after families, etc. Okay, Mary.
Thank you, Patricia. Thank you, Lynn. Thank you all. I shall be brief. I'll just say a few words and hand it back to Patricia. So my name is Mary Creighton. I'm the head of the community outreach program at Dunham House. I'm based here in Montreal. I reach out to all our schools, hospitals, community groups, private clinics, basically anyone that'll talk to me. I wanted to briefly touch on current challenges facing mental health and addiction services. Maybe we'll start with government funding. Government funding reductions continue to impact the English language mental health and addiction services, Organizations are facing increasing demand with fewer available resources. Vulnerable population is losing. That has a snowball effect. Addictions lead to homelessness, another one of our big problems. I'll point to a particular casualty, and that's the Griffith Edwards Center closing. At Dunham House, we're very honored and fortunate to have the services of Dr. Dara Charney, MD, psychiatrist at the MUHC, as our psychiatrist when we need. The program was closed by the government on, I think it was the end of 2024, sadly. Our Anglo population is now referred to the SHUM, where there's a need, when there's a need, often leaving gaps. Excuse me. So effects of the funding cuts, impact on services and communities, reduced community programs, limited outreach initiatives, decreased supportive care, longer wait times for treatment. That'll bring me to my last point, which is the importance of fundraising, why fundraising matters. Fundraising has become essential to sustaining and expanding services. Community supports and helps organizations offset operational costs, maintain critical programs, and expand access to services. Community donations, grants, partnerships, and philanthropic support help offset costs and allow organizations to provide a continued or a true continuum of care. Fund support, aftercare, peer support, family programs, relapse prevention, counseling, and long-term recovery. The recovery journey can be a long and arduous one. A couple takeaways. Government cuts have significantly impacted access to mental health and addiction services. Demand for support continues to rise. Fundraising is now a critical component of the service sustainability. If you or anyone you know suffers from addiction, mental health challenges, please reach out to us. Finally, as a nonprofit organization, we need the kindness of donors more every day to be able to offer an English service to those in need. Again, at Dunham House, we have a total of 38 beds, which 26 are government funded, 12 are private. Thank you very much for your time.
Thank you. Thanks, Jason. Wow, I really like having an IT specialist. What a treat. Okay, so just to go through quickly, because I do want to get to like some questions that you may have. So our outpatient services are through our office at the Queen Elizabeth Health Complex. So we offer outpatient programming through there. It's 12 weeks. What that looks like, it's 2 group therapies per week and 1 one-on-one counseling session per week. Our family program is 6 weeks in length, and that is just group counseling with our family counselor. We also offer one-on-one family counseling, individual counseling, and of course our RTP program, our Recovery Transition Program, which is our peer support. We went through basically what the recovery journey looks like. So our Montreal office team, the outpatient services are guided by an experienced leadership team that provides clinical oversight and program direction, ensuring compassionate, consistent, and evidence-informed care tailored to individual needs. Victoria Della Porta, Executive Director, Shannon Partridge, myself. We have Jenna LaBelle, who is a PhD psychologist. She is one of our associates. We have Gordon Adamson, also an associate counselor, and we have Shanna Mahan, who runs our outpatient services, our groups. The 12-week outpatient service, what I just ran through, 2 support groups, Again, the different topics that we explore. Just for time, I'm moving a little bit quickly through this because we have touched on some of it. So the 6-week family program, I really just want to talk about for a minute because it's super important. So just like aftercare is important, I believe, and it's also been shown, proven evidence-based, that, family program, when having family members in some sort of recovery themselves, is very advantageous for the person. It's very advantageous for the family members, the friend, the boss, the workplace individual. And this is all information that is valuable to everybody, not only really the families. So this is really important. The family gets to do their own work. Very often, because we're in close proximity to somebody who has been unwell, we ourselves become unwell without realizing it, right? We adopt these coping mechanisms that aren't healthy. We do all kinds of things thinking that we're helping the individual, but in reality, we're not. When you go to a professional, it's a very different type of thing than when you intervene amongst your family members. So that is, the family program is only once per week. The themes are there, and there is a small cost of $550 per person. Individual counseling, also we offer that. It's a 50-minute individual counseling session, and the rates differ depending on the professional that you're seeing. The recovery transition peer support we've already reviewed. The Dunham House alumni, also very, very nice and good, and a lot of support going on there. And that's basically what we have to offer at Dunham House. So my information is going to be readily available to anybody that might need it. I understand that this could be a touchy situation, but if you guys have any questions, or even if it doesn't pertain to you, please come forward and ask me. And if you're too shy today, you'll have my phone number. I'm always available, literally always available. It's very important to me that I be on the other end of the phone when somebody calls and wants help, and that's what Dunham House is about. So thanks so much for listening to me. Thank you. Thanks.